let's talk a little bit about knee pain. First, how does a healthy knee work, and what is the anatomy of a healthy knee?
The knee it's a largest synovial joint in the body. It's actually designed for propulsion and puts the position, and it helps where you can move straight and also bends and reach out.
And arthritis, what exactly is arthritis, and how could that affect a person's knee joints?
Well, a knee joint is a bearing joint. And arthritis, by simple, it's just wear of the articular cartilage, which glides the movement, and then bone starts to rub on bone. So the more you load the joint, the more wear problems you have.
Now, I know there are some non-surgical treatment options for chronic knee pain. What would they be?
We'll always start with non-surgical options, and as we said, it's a bearing joint, so it's always important to keep an eye on the weight. Job-wise, if it's a heavy manual job, you can think of into a desk-type job, so that means changing job-wise. Also activities, if you are keen on sports and leisure, as long as they are, so we do the low-impact type sports, swimming, cycling, rather than running.
And, anyone who follows sports has probably heard the term orthoscopic knee surgery and getting a knee scope. What is that, and when might that be a good treatment option for knee pain or an injury?
Arthroscopy is basically introducing camera into a joint. It's it's one of the commonest and orthopedic surgeries done across the United States, orthopedic-wise, and it's a day-type surgery. It's used commonly now for meniscal or cartilage problems, where we can deal with especially sports-type injuries.
And it's outpatient?
It's an outpatient day case. You come morning, have it done, and then home later.
7 months ago, I was diagnosed with fibromyalgia, arthritis of the muscle. I've been put on prednisone, and I'm told is there anything else besides prednisone? There is a new medication, but I have macular degeneration. I can't take that because it affects the eyes, and the side effects are very bad for me. I have osteoporosis. It's bad for osteoporosis. Is there anything else that I can learn about it or take?
Dr. Morava?
Good morning, Helen. First of all, fibromyalgia is not arthritis. Arthritis has to involve joints. Fibromyalgia involves muscles and soft tissue, so it really is not an arthritic type problem. It's more of a soft tissue type problem. And what you need to do is you need to see someone who specializes in this, and this is usually not an orthopedic issue. It's more of a person who deals with immune diseases or autoimmune diseases. Frequently, they can change the medications around. Prednisone, unfortunately, will give you osteoporosis. It does mobilize calcium out of your bones. It is also quite good for the fibromyalgia, but sometimes it can cause, as you alluded to, other issues. And I think there's a broad spectrum of treatment, potentially even some new pain medications that can control the pain of it, one being called Lyrica, which works fairly well. So I think what you need to do is really see someone who is a specialist in an area, and that would be more of a autoimmune type doctor or someone who deals in rheumatoid arthritis type things, which is an autoimmune process as opposed to an orthopedic surgeon.
Okay, someone at Oakwood could...
Yeah, if you just call into the Oakwood hotline, they'd be more than happy to give you the name of a physician that deals in the autoimmune area and take care of it.
Okay, thank you.
You're welcome.
Thank you, Helen, for your call. 800-859-0WJR, 800-859-0957. Let's go to Donovan from Whitmore Lake. Donovan, what's your question this morning?
Good morning. I'm real glad that you're able to provide a program like this. I'm asking a question for several of my friends and me. We've been having conversations. There are falls, arthritis, and such that get together along with some osteoporosis. We'd like to just hear a little general response to the types of technology that are offered, things like screws, wiring, and in my case, whether or not to consider a cage because of a fracture that an already artificial ball is there. Would you be able to find someone to answer questions like that?
Dr. Sorcy is here, Donovan, and he will answer your question. Dr. Sorcy?
Good morning, Donovan. That's quite a question you have. There are a lot of things I heard you asking your question. First of all, you mentioned a group of your friends concerned about technologies as far as with arthritic problems. There's a lot out there, several of which I partake in. One would be computer navigation when it comes time to replace a hip or knee joint with artificial joint or toe joint replacement. We use computer technology to line that joint up within a half a millimeter and a half a degree of the patient's mechanical axis, which is much more accurate than the traditional jigs that we use that are based on average human anatomy. And why that's important is that we've discovered if, let's say, a knee joint is off just 3 degrees, which is something, as a surgeon, I cannot detect with my naked eye, that 3 degrees in a 170-pound individual will increase weight bearing 325 pounds per step. And that, by being 3 degrees off, the longevity of that joint would not be as long. That's one of the technologies. Others would be type of bearing surfaces. In other words, what surface articulates with another surface. There's traditional metal on polyethylene or plastic. There's ceramic on ceramic, metal on metal, and ceramic on polyethylene. As far as some of your other questions, if I remember correctly, you asked about possible screws and implants for the spine. You said you had a cage in your spine. This is not my area of expertise. As Lloyd had mentioned earlier, Dr. Neelish Patel is going to be having a conference later on, and he is by far a very well-educated individual in the area of spine surgery. I do recommend you follow up with his lecture, and he'd be happy to answer those questions. And as far as the falls, you had mentioned concern about falls. That's very concerning, especially the population of older women in general, older Caucasian women especially. After age of 26 years, you stop making bone, and from that point on start losing bone, especially the postmenopausal population. This makes your bone very weak, and a simple little fall that perhaps at age 30 you would have been upset that you tore your pants on now might cause a hip fracture. And so the best medicine is preventative medicine, and therefore having caution about falls. If that means pulling out the cane or the walker during this January months in Michigan, that would definitely be a wise insurance policy.